Pranam Dar Croeso, good afternoon and welcome to the annual general meeting of Digital Health and Care Wales. Our AGM today relates to the DHCW report and accounts for the year 2023-24. Just to start, I'd like to note apologies from two of our independent members who happen to be out of the country at the moment, Rowan Gardner and Alistair Class-Neal. We're holding the AGM today virtually, as we do with current practice with all our public meetings, and people are able to follow the meeting live, and a recording of the meeting will be available shortly via links on our website. Simultaneous translation facilities are in place, and you may well need them later in the meeting. If you haven't, not familiar with it, if you hover on your screen with your mouse, you'll see an icon 4 in from the right, which has got interpretation and looks like a globe. If you click on that and select English, you'll then hear the simultaneous translation feed automatically, and the icon will have changed to a white circle with EN in it. Okay. We have a question and answer session planned for at the end of the second half of the meeting after the presentation. We've had a couple of questions in advance. If you wish to ask a question, please do use the question and answer icon again by hovering on the screen. You'll see it. It's the second in from the left. If you do wish to ask a question, it'd be really helpful if you could get those on the Q&A function before the end of the presentations. That would help me considerably when I'm chairing or moderating the question and answer session. If we run out of time, if some questions haven't been asked by the end of the meeting, which is scheduled for 4 p.m., we will answer and publish all questions, and the response will be available on our website within 14 days of this meeting. Great. I'd like to thank all board members, independent members and executive directors and directors who sit as part of the board for their commitment to DHCW over during 2023-2024. The insight they have brought to all discussions has been very useful and essential to the discussions and the decisions that we've made through the year. But of course, we wouldn't be where we are today without the commitment, hard work and dedication of everyone who works for DHCW. So my sincere thanks, both personally and on behalf of the board, to all DHCW staff who have worked through the year and continue to do so into the future. You make a massive contribution to the delivery of quality digital healthcare services for the people of Wales. As everyone will know, the year hasn't been without its challenges. The financial constraints on the NHS in Wales are well known, and we felt that those, just the way everyone else in the NHS delivering services has felt the financial constraints. We've continued to attract and recruit great staff, and that has ensured that we do have the capacity and capability to move into the future, notwithstanding the financial constraints that we are currently under. And I'm really proud of the fact that our digital services have been absolutely key to the safe delivery of care for people right across Wales through the year. So I'm going to hand over to our Chief Executive, Helen Thomas, who will provide a brief overview of our 2023 annual report. Over to you, Helen.
Diolch, Simon. I'm delighted to bring the 23-24 Digital Health and Care Wales annual report and accounts to the AGM today. It reflects our achievements and challenges during the year and a look ahead to this current year. So the DHCW annual report for 23-24 is published as a single unified document, and it can be seen in the AGM papers. But it's also available on our website as a digital interactive report, which includes the performance report, the accountability report, and the financial statements. And I'd urge you to go and have a look at our website to see that. And perhaps you can ignore the video of myself and the chair at the beginning. But so I'd like to remind the board that the annual report and accounts as a whole must be fair, balanced and understandable. And as the accountable officer, I take personal responsibility for this. and the judgments required for determining that it is fair, balanced and understandable. So I'd like to extend my thanks to all colleagues across the organisation for all their hard work this past year, and a special thank you to the staff involved in the delivery of the annual report and accounts. So I will now hand back to our chair to start the DHCW showcase and the forward look presentation. Thank you.
Thank you, Helen. Some slides are going to come up shortly, and a number of the executive team directors are going to cover individual slides. So we're going to share the progress of our achievements of 2023-2024 as a statutory organisation. We'll also talk about our finances, our people, our services, and our plans for the future. So Helen is going to introduce the first slide, and I think then seamlessly we'll move between members of the team who will take us through the rest of the slides in the presentation. Over to you, Helen.
Diolch, Simon. And if we move on to the next slide, please. So it gives me great pleasure to introduce the showcase today. So this is a look back at 23-24 and a look forward into 24-25 and the exciting year that we have ahead of us. It's been another year of achievements, I would say, but also challenges, as you referred to in your introduction, Chair. But I'm really pleased with all of the progress that we have been making in our third year of operation as a special health authority. But I'm not going to take up any more time. I'm going to hand over to my colleagues to take us through the showcase, and I think I'm coming back in at the end. So I'm going to hand over to Claire Osmondson-Little, who's our Director of Finance and Deputy Chief Exec.
You're on mute, Claire.
Thank you, Helen. Sorry, I was on mute. Can you move us on to the next slide? Okay, so it's as we know, the financial backdrop from the NHS this year has been challenging, but I'm pleased to report that DHCW has achieved all its statutory targets. And what that means, it's achieved its revenue funding within the target level that it was set. And as I will show you later, the total spend for DHCW was 165.6 million, which is 307k or 0.2% below its revenue funded cap. And equally, in terms of capital, we spent a total of we were 19k lower than our funding allocation, which is a 0.1% within our funding envelope. In the terms of our annual plan, our secondary financial duty, that was met and approved, and also our annual accounts gave a true and fair view and received an unqualified audit opinion. In terms of our administration targets, these are the public sector pay policy, which requires us to pay our suppliers within 30 days. We achieved 97%, which is 2% above the target that we're required to deliver. And equally, our cash management, we maintained a balance of within 2 million at the year end, and again, achieved the target as set by Welsh Government. So I'll move us on to the next slide. And this slide tries to illustrate our revenue, where our revenue funding comes from and how we spend it. So the dark blue boxes on the left-hand side total 165.9 million. And what that shows is that we have core funding of 110.8 million directly from Welsh Government. And that comes for our core, for our primary care. It also includes our depreciation. It includes our DPIF allocation, and also includes our COVID allocations. We also receive funding from the NHS in Wales through the SLA, so that's our service level arrangements, Microsoft, and supporting the primary care laptops. That totals 53.8 million for the year. We have other income, small levels of income from NHS Wales, and a very small amount from Northern Ireland, which means our total income was 165.9 million. And we then spent that money primarily on operational services. And to give you an idea of what that 96 million is made up of, That includes all our Microsoft licenses. It includes our data centers and our ICT and our development costs, together with our programme teams, our clinical libraries, and the primary care and mental health support. Further to that, we've got primary care funding of 17.3. We have depreciation, and that's of 9.9, and facilities of 1.8. We then invest in digital developments through the Digital Priorities Investment Fund. That totals 33.7 million, the box in purple. And finally, we maintained and supported our vaccine and our track and trace systems, which are the ones in yellow, and total 6.8 million for the year. So overall, we were 0.3 million underspent, and you can see from this where our funding came from and where we allocated it. So I'm going to hand over next to my colleague. Next slide. To SJ.
Thank you, Claire. Thank you very much. Yes, it's been quite a busy and challenging year. So I've just tried to take a few of the highlights from shaping our workforce and all the component parts within that, really. So I'll start with leadership. We've had a really great year, and I think we talked through this in very high level terms earlier in the board meeting. But we've got leadership and development and talent opportunities now for everybody. So we've went through the King's Fund leadership programme for the 8th season above, and that was really well received. And as Helen said earlier at the board, that will be continuing as an in-house provision to move that forward and to progress that for this year. We've worked with Silver Maple to look at the talent cohort and work through various things with the talent cohort, the band 6s to 8Bs. And we launched and delivered the 3s to 5, the emerging talent, which was great. And that was an in-house joint effort, and a big thanks to colleagues in the room, especially to Sam Hall, who helped deliver some of those modules. And that was really well received as well. I think in terms of a great organisation to work, we've had a number of acknowledgements from the British Computer Society in terms of our external accreditation and nominations, and winning various different accolades, but also through our staff awards and recognition and feedback. It's been a very sort of positive space to operate in. In terms of strategic workforce planning, we've worked really closely with Gartner to look at best practice modelling and made it a little bit more strategic this year. I think we mentioned last year that it was quite operational. We've done an upskilling of the managers. We've worked with some brilliant directorate managers out in the organisation. So it's been a really good joint enterprise, and everyone's made a significant push on that. So that's been great, and it's really enabled us to showcase where we are with our skills gaps and what we need to go after. In terms of new ways of working, there's a new programme of work, and I think Claire will talk about that a little bit later in this presentation, in terms of building our future, the cloud strategy, moving to product approach. But we've also done other things, the new health and wellbeing policy, but indeed working in partnership with the trade unions to support the hybrid working policy, which was great. And finally, the wellbeing and engagement piece, and the equality, diversity, inclusion. Big thanks to volunteers throughout the organisation who sit on both the health and wellbeing group and the equality, inclusion and diversity network. It's been really welcomed and very active and really supportive, developing a number of initiatives and deliverables for everyone that works in the organisation, but also through independent, international and British standards accreditation and acknowledgement through the ISO 3415 and the BS 76000, and also receiving the highly commended awards at the HPMA for EDI as well, which was brilliant. So lots in that space, really. So yeah, hopefully more to come. So thank you. And I shall now pass over to my colleague, Evan Evans.
Thank you very much, SJ. If we can have the next slide, please. And as we move, it is a pleasure to have the opportunity to look back at the achievements of the organisation over the past year. I'm really grateful to the teams across the organisation in its entirety, and I just want to say how much of a pleasure it is to work within the organisation and to work with people within those teams in all of the directorates. It's a fantastic place to work. But we cannot do anything on our own, and partnership working is an absolutely integral part to the way in which the NHS and the public sector in Wales works, and we have very many stakeholders and partners. I'm not going to go through all of them on the screen here. I will extract a few, but just to say that during the course of this past year, the board has taken a major interest in our strategy and our plan to work with stakeholders and continues to do so. And at the moment, we're just concluding some analysis work on the feedback that we've gleaned from all our stakeholders, because we are absolutely committed to showing how important that is to us and to be transparent and open in terms of feeding on the nature of the relationship so that we can continue to improve it. As I said, I'm not going to touch on all our stakeholders. Welsh Government clearly is a very important one to us. They are the ones who fund a vast majority of the organisation, and also they are the ones who set out the national policy direction for digital and for health. So we're working very closely with them. It's an integral part of our statutory duty to provide advice on digital to Welsh Government, and we try to do so, and we work very closely with the National Health Service Executive as well. Secondly, we don't directly deliver generally to patients, apart from the app, and we'll talk a little bit about that later. We work through other organisations within the NHS, partners such as primary care contractors, and particularly the tens of thousands of staff who use the digital services that we provide. They're very important to us. We invest in that work in order to make sure that we provide the tools and the services that they find useful. And then thirdly, I just want to talk about the suppliers on whom we depend. There are many of our systems, many of the systems that we are responsible for, a number of systems that have been provided by suppliers. We also work very closely with NHS England, for example, and with others. And there is a supplier nature to that service. We're very reliant upon them for some of our key services. So we invest heavily in that relationship in order to ensure that it's more than simply a contract, and that it is a relationship which is closer to partnership, so that we understand their needs and that they understand our needs. So just really to conclude on this, I want to emphasize how important our stakeholders and partners are to us. If we can move on then to the next slide, please. There's one further slide for me before I hand over. So we're moving now into the 5 missions that we have. The 5 missions are included in our strategy, our medium-term plan, in our annual plan, our annual report, etc. So they're vitally important to us into how we structure our work and how we structure our strategy and so forth. There's quite a lot of achievement that's been seen in the past year, 24-25. And I just want to provide a taster of that in terms of the work that we've been doing investing in our data centres. There was a report at the board meeting this morning and how we've completed that process, and that is really of merit to the teams. Then in terms of client services, we provide for our own organisation, but also on behalf of primary care and other services, including prisons and others. We have 16,000 users, more than that actually, in terms of the number of devices. So there's an awful lot of work going on across the whole of Wales. And that work, I know, is done very, very professionally. Moving then on to security. People who've been paying attention to the news will have heard of many cyber attacks recently. And this is an ongoing work for us day to day, and our partners, particularly the health boards, to make our systems as secure and safe as possible and keep them as safe and secure all the time, because there are threats from all directions, thousands and thousands of threats on a daily basis. And we have got to be looking after this area of work all the time. There's a lot of important work going on in that regard. And in terms of the National Data Resource, that's a very important programme. Last year, it was a milestone. There was a milestone for the programme that it went live as a platform for the first time back in August. And it really is a very great pleasure to see that happening, and I'm very pleased in what's been achieved. And we are now starting to bring data services live on that platform, starting with terminology services and such core services. Finally, then, we are extremely aware within the organisation that we are responsible for data that can be very personal and private, and that it's vitally important that we are able to protect and safeguard that data and use it responsibly and securely, and keep a record as to how we use it. And we, to an extent, work as a centre of excellence across NHS Wales. And we work very closely with the Information Commissioner's Office and others. And there is very good and important work that's been undertaken last year in that regard. I'm now going to hand over to Sam Lloyd for the next mission. Sam.
Thank you, Ivan. I'm Sam Lloyd, Exec Director of Operations, and I'm going to talk about Mission 2. So if we could move the slides on, please. So Mission 2 is about delivering high quality digital products and services. This covers major clinical areas and care settings across primary and secondary care, including the major national products that we deliver on behalf of NHS Wales. This is about us helping to deliver person-centred care and supporting the transfer of care between different settings and across boundaries as simply, effectively and safely as possible. There are a large number of services in this portfolio, so I'm going to touch first on our overall service availability and then pick out some of the highlights that we've delivered in the last financial year. So looking at our availability overall, we take very seriously the fact that healthcare professionals rely on the services that we provide. And at 99.984%, our availability this year was above target, and this reflects our ongoing investment in the stability of our services. Like any technology service, we do experience major incidents, and we had 44 in this period. 98% of those were resolved within our target fixed times, and we always conduct reviews of major incidents to capture the lessons learned. And our availability over time is gradually improving, which does reflect the investment that we're continuing to make. So moving on to the digital medicines portfolio. So this combines projects that will deliver benefits of a fully digital prescribing approach in all care settings in Wales. So that includes e-prescribing in primary care and secondary care. It includes the establishment of the shared meds record, which is to help provide a common view of medicines and prescribing informations across different systems and settings, so to help clinical decision making. And it's also about giving patient access to medicines information in the app. We launched the first electronic prescription service in November, and the Minister for Health and Social Care visited some test sites to mark that occasion. And since then, thousands of prescriptions and prescription items have been sent using the service. So moving on to primary care. So we provide primary care with a growing range of digital tools to help GPs manage records, organise their daily tasks and care for patients. And further to the establishment of the Primary Community and Mental Health Directorate at the end of last year, we've developed our primary care strategy. This was published in Q2 and aims to provide DHCW with a platform from which we can deliver digital products and services with improved value and benefits. It hinges on 4 principles of delivering quality, informing policy, building value, and guiding and standardising the use of data and information. So moving now on to our vaccines programme. So the Welsh immunisation system is at the heart of the COVID-19 vaccination programme in Wales. It also supports the administration of seasonal flu vaccines alongside COVID or at walk-in flu clinics. GP patient records are automatically updated with vaccine or vaccination information from this system. And the system is used across all health boards with nearly 14,000 users in vaccination settings, over 8,000 in general practice, and 352 in pharmacies. And we recently supported the 10 millionth COVID vaccination in Wales. So the diagnostics programme, we're working to integrate new laboratory and radiology informatics solutions, expand electronic test requesting functionality, and enhance the national availability of diagnostic results and reports. This means better access to test results, improving patient care and clinical safety. Better information sharing across boundaries and the improved storage and distribution of imaging are also key goals. In the previous financial year, we enabled 40 million laboratory tests to be managed, and also the creation of 2.8 million radiology requests. And so I'm going to hand back at this point to Ivan Evans. Thank you.
Thank you, Sam. If I could please have the next slide. We're moving on to mission 3, and this is a very exciting mission. It doesn't matter how strong our infrastructure and our platform may be. It doesn't matter how good our digital services are. If users don't make use of them, then there's not going to be much difference seen for the patient. So what we do is ensure that we provide tools and services that are useful, and we keep data, and then we can feed that back by way of information to help people to do their work and make their work easier. That's very important to us, coming back to the theme around stakeholders and working with and through partners. So that's what you can see here on this screen. The first piece of work there is around UCD, user-centered design, so that we can provide more emphasis on that, working very closely with our users, understanding what they need and providing for them, and the tools that will make their work better and easier and help them work better. That's really important and increasingly important to us. Then the another center of excellence, that's the Microsoft 365 center. There's been huge investment in Microsoft 365 as a service across the NHS in Wales. We are the ones who provide the tenancy for all health bodies, over 100,000 users. A huge sum, a very significant sum of money spent there. And the purpose of the Centre of Excellence is to get the best possible value for money out of that substantial investment on an annual basis, working closely with health boards and health trusts and others. One of my favourites, and we have a question later on about the app, and that is the NHS Wales app. 24-25 is a very important year. No, sorry, 23-24 was a very important year, and launching the app as a public beta in April 2023, and by the end of the year, March of this year, it had engaged with all GP practices in Wales and close to 180,000 users. I think by now, in July, we are up to 240,000 users on the app. That's a substantial, very significant increase, and the app is a shop window for us and a vitally important service. And it's an area where we have the most direct contact with the public and with patients. There is other work, and the heart of our work is working with staff and providing digital systems for staff in hospitals, usually, but also in primary care as well. And the next three services are examples of that, namely the Cancer Informatics Service and the Welsh Nursing Care Record and the Welsh Clinical Portal. There are tens of thousands of users day to day, now at this very moment, in those services across the NHS in Wales. They are vitally important to the delivery of safe care of high quality across Wales, and they are very important to us, and we're continuing to invest in improving those systems. Then finally, we also provide e-library services, again, across the whole of Wales, so that staff are able to get hold of the information that is relevant and timely and with the evidence they need to make clinical decisions of a high quality. So what you'll see in this mission are a number of services and a significant progress made during the past year, particularly in terms of the app and across all areas. And I think that what I'd like to draw most attention to is the investment or the increase in our investment in working directly with users in order that we can provide the best possible tools for them in their work. And I'm now going to hand over to Rhydian Hurl, please.
Good afternoon. Thank you, Evan. My name is Rhydian Hurl. I'm the Medical Director here at Digital Healthcare Wales, and I lead on the strategic objective number 4, which, if we have the next slide, shows you that we're here to drive better values and outcomes through innovation. In the annual report on page 50, you'll see details about the research and innovation portfolio, and links to the first annual report relating to that. We've been working in partnership with a number of key stakeholders, including the likes of the Bevan Commission, Blood Cancer UK, Welsh universities and others. And we've delivered the objective of find, recruit and retain. So this is the outline plans for the ability for patients to enroll within clinical trials. And we know that patients who enroll in clinical trials tend to have better outcomes. And the other part of this is value from the data. And again, you'll see in the report on page 51, the information analytics strategy. Some good progress has been made with the Welsh Health Intelligence Portal, the General Medical Practice Escalation Tool, and a number of other tools. You can see on from the Health Intelligence team online, you can see some dashboards which show statistics of performance around Wales, both in primary and secondary care. And we provide a number of dashboards that allow clinicians and leaders across Wales to consume data in an easy to use common format, so that we can help service improvement and learning. And I think now I have to hand over to Claire.
Thank you, Rhydian. Diolch, Rhydian. We now go to the final mission of DHEW, which is all about being that trusted partner that produces high quality, inclusive and ambitious organisations. So if we move on to the next slide. And what the makeup of that mission really encompasses all the enabling factors to make DHEW a successful organisation. Most importantly is the people and our values and culture that really underpins the organisation, supported by the finance teams that really focus on sustainability, but also on the benefits and value that we create. Sustainability has many factors, and it includes our commitment to the social economic aspects of the foundational economy, but also improving our decarbonisation and biodiversity. And we do that through engaging with our broad range of stakeholders. And at the centre of all of that is ensuring that we are a quality organisation, and we embed the dynamics of quality in our thinking and in what we do. We have a strong governance and assurance process, and we aspire to the highest standards. And we also lead the way in contractual services across NHS Wales with a digital edge towards them. So I'm now going to hand over to my next colleague, which is about looking forward. So I'll hand over to Helen, I think.
Yeah, Eva next. If you move on to the next slide,
sorry.
please, then. That's okay.
Sorry.
No problem. Thank you, Helen. Thank you, Claire. I should have introduced myself as everybody else has done. I'm Yvonne Evans. I'm Executive Director of Strategy. So I spend all my time looking towards the skyline, wondering what's coming next in the future, or perhaps not quite, but that's an important thing to do, actually. While we have achieved much in the past year, and while this year is important to us, and while teams across the organisation are extremely busy from day to day providing services that are secure and are used by tens of thousands of people across NHS Wales, then we have to forward plan, and the area of digital is fast paced and fast changing, and we have to think about how we're going to move towards the future and what we do. If we can move then to the next slide, please. So for those of you who are watching the report, the way to get the details is to go on to the DHCW website and to look at the strategy, the long-term strategy, which is our strategy up to 2030, a 6-year period, and to look at the IMTP, which is the detailed plan for delivery over the coming 3 years, which shows how we are going to reach at least the first half of that journey. And those documents include the 5 missions that you can see up on the left-hand side of the screen there. They are consistent throughout all we do, over a 6-year period, over a 3-year period, over a 1-year period, so that we can ensure that we continue to move in the direction which we should be moving as an organisation. But there is room for improvement, and there's always room for improvement. It's part of the digital culture, continuous improvement, iterative development, and we want to improve on some of the things and some of the methods of working we have. And there are 5 principles that you can see on the right-hand side of the screen there. They are some of the things that we're going to be making use of in order to test ourselves every time we make a decision, every time we consider what to prioritize, and we have to prioritize all the time. Every time we consider and plan, we ask these questions of ourselves, and we ask these questions of our teams to ask themselves, so that we can continue to improve the way in which we make decisions and how we can get the best possible value out of what we do. So just very briefly, people are vitally important to us: stakeholders, our own staff, users, our digital tools. They are our main priority, that we think about the people who use our services. There is considerable complexity in what we do. There is complexity and diversity and variation that can create additional work. So we want to try and streamline the way in which we work and the way in which our systems work for users. We know that there will be increased data, more digital in 5 years' time, and there'll be even more in 10 years. There's only one way that digital is moving, and that's to get more and more important and bigger. So we have to plan for that. We have to consider how our systems and our platforms and our infrastructure can handle that challenge that we have ahead of us. And in doing so, we have to look for additional value in all that we do. That's about being more productive, but it's also about using new technology such as artificial intelligence, and it's about ensuring that the value of the substantial investment made in digital technology is realized across the NHS. And then finally, we have to learn from the past and move on from the past and into the future. If you go on to the next slide, please. I prefer the translation, actually, learning from yesterday, moving to tomorrow. But it's digital, as I said, it's very fast paced and fast moving, and there's a cost involved in staying too long on historical technology that gets more expensive and more fragile. So it's really important that we continue to move forward and make use of the most up-to-date modern technology we have. So just a quick glance is what you have here as to how important our strategic vision is to us. The details, as I said, are included in the strategic document and in the IMTP, both of which are relatively concise documents and worth reading. So I would recommend greatly that you do so. And with those words, I'll hand over back to Helen.
Diolch, Ifan. And if we can move on to the next slide, please. So in order to achieve the ambitions, as Ivan's just set out, that we've set ourselves in our long-term strategy as an organisation and achieve the mission that Claire set out in being that trusted strategic partner, a high quality, inclusive and ambitious organisation, we acknowledge that we need to change and we need to change the way we work as an organisation. So that's why we are this year setting up a transformation programme, the Building Our Future programme, which Claire is leading for us as part of the executive team. And this will oversee kind of how we are going to bring the principles that Ivan has just talked us through in our strategy to life. So how are we going to ensure that we are putting people first and that we are actually ensuring that we are supporting our teams to be the best that they can be and give them the development and opportunities that they deserve, and we become that dynamic organisation and the best place to work and maintain being the best place to work, and ensuring that we are simplifying all that we do and standardising, designing again for the future, with the certainty that we will have more data and more digital, that we need to ensure that we are ready and set up to embrace that and find the value. It's not just drive value. This is about finding more value and how do we sustain and improve and become more efficient and find the value, not just for us as an organisation, but importantly for the wider NHS. And as Ivan pointed out, that embracing the future there, that is about how do we modernize our services and our systems, and embrace how do we kind of ensure that all of that is designed in to take us forward. So hopefully what you've heard from us this afternoon demonstrates how Digital Health and Care Wales is making digital a force for good. So on that note, Chair, I think that I will hand back to you.
Thank you, Helen and team. Obviously, that run through or counter through has given you everyone a really good overview of the sheer range of things that are going on across the organisation, and also I think very helpfully a very coherent way that that's been expressed through those 5 missions. Okay, so question and answer session. We've had a couple of questions presented in advance, none as of yet in today's Q&A function on the Zoom call, but if any do come through, I'll keep an eye out for that. But the first question I think probably is one for you to pick up initially, Sam Lloyd, and that's what are the biggest external threats from a cyber perspective, taking into account some of the recent cyber attacks elsewhere?
Yeah, thank you, Chair. This is a really important question. We do live in a world of increasing cyber threat, unfortunately, and one only has to look at the news to see that the prevalence and severity of cyber attacks, particularly against the health sector, is growing, and that's a very worrying trend. We recently saw an attack against the pathology supplier to several London hospitals, and that led to appointments and operations being cancelled and sensitive patient information being published on the dark web. So these attacks are causing real harm. That was a ransomware attack, and by ransomware I mean an attack where cyber criminals are able to infiltrate a network and encrypt the data that's held by an organization, so that that data becomes inaccessible to that organization, and only those criminals have the key, and they therefore ransom that data back to you by giving you the key when you pay for it. This, I think, is the biggest threat to health at the moment from a cyber perspective. It is really damaging. It takes a long time to recover, and it causes a lot of harm and distress. What we're also seeing, which is closely related to the ransomware threat, is the increasing professionalization of cyber crime. So you can actually buy ransomware as a service from service providers who will happily sell it to you and conduct an attack on your behalf. You can also buy lists of vulnerabilities from other providers, and you can combine those into a very damaging attack. So it's becoming possible for people who really are quite, have limited technical knowledge to actually mount quite sophisticated attacks. We saw last week the CrowdStrike issue, which wasn't a cyber attack, but it does serve to illustrate, I think, the extent of the interconnectedness of systems across the across the world, but particularly across the health system, which I think is an illustration of the supply chain dependencies that we have. We're dependent on suppliers, we're dependent on partners. There are a lot of complicated relationships which are quite difficult to kind of map out and understand, and therefore to understand and be able to anticipate the extent of an attack on any part of that system. And then lastly, AI is both a threat and an opportunity. It can be used to defend against cyber attacks, but it can also be used to really develop quite advanced cybersecurity attacks on the fly and circumvent organizations' defenses. And we're also seeing AI being used in social engineering. So the tech that enables chatbots and things to be, to appear as quite convincing from a human interrelation perspective can also be used to undertake social engineering attacks and convince you that you're talking to something which is genuine, and therefore it makes it easier to entice people to part with their credentials and so on. So we're seeing AI used in phishing campaigns and so on. So I think that's just a flavour of the threat landscape. It is something that we're taking very, very seriously.
Thank you, Sam. I had another technical glitch while you were talking there, I'm afraid. I think too, I wanted to add that, though obviously the perpetrators of cybercrime see it very much as an issue of financial gain, and indeed the consequences of any form of cyber attack in terms of putting things right have huge financial consequences for whichever organization is attacked. And you pointed out yourself in terms of operations cancelled and other clinical issues, and it's really important that we see cyber attacks in the context of patient safety and citizen welfare, because it might cost money to put right, but whilst has gone wrong, there's significant potential harm and risk to patients, which is easily lost, I think, when the big money figures are talked about. Anyone else want to add anything on the cyber before I move on to the next question? Okay, the next question was submitted in Welsh, and I think it's only courteous that the question is asked in Welsh, and I'm going to ask Ivan to do that, but also it's a question that very much falls into his area of responsibility, and ask him to follow up asking the question by answering the question. So over to you, Ivan.
Thank you very much, Chair. So I'm going to read the question first and then I'll answer it. So the question was, the NHS Wales app is an exciting development for the people of Wales to access useful information and make appointments and order prescriptions. However, there seems to be a disparity between the range of access across Wales at the moment. For example, my GP surgery hasn't signed up yet. However, I can order prescriptions, which is excellent, by the way. And so when do you envisage that this will be resolved so that there's equity of access across the whole of Wales? So thank you very much for the question. And I'm very pleased that there are fantastic things in the app, clearly, and the use of the ability to order prescriptions is increasing quickly, and I think up to 70,000 prescriptions a month being ordered, I think, at the moment. So all GP surgeries in Wales are connected to the app, but what they have enabled within the app varies from one practice to another, and there are a number of reasons for that. All practices work independently and they work in different ways, and they arrange their contact with patients in different ways. And we've respected that as we have connected practices for the first time. And on top of that, as you would have seen, if you look at the news and listen to what's going on in the health service in general, the profession is one which is under very significant pressure at the moment because of work pressure and people retiring and so forth. And the number of practices in Wales has reduced significantly over recent years, from over 400 to about 371 or 373 or something like that at the moment. So it is a profession that overall is under significant pressure. So turning everything on all at the same time immediately is something that firstly is going to perhaps cause a considerable amount of concern, but also considerable pressure in practices, in those practices that haven't had an opportunity to prepare for this. So we're working very hard to assist all practices to understand, and we're working very closely with these practices and with the primary care team in Sam Hall's team, but we're working also with Welsh Government on the policy and on the annual negotiation on the contract for general practitioners, so that we are able to do this in cooperation with the profession and do this in a sensible way across the whole of Wales. And it's not DHCW alone that determines or decides when to switch things on. Like all of our national programs, this is a cooperative, collaborative program where we have stakeholders and partners with whom we work very closely in order to make sure that we reach the best possible situation and the best possible and most appropriate balance across the whole piece. So I don't have a date, unfortunately. I can say certainly that this traffic is moving only in one direction, and that is for there to be increased features being switched on in the app, and also more and more users making use of the app and more services being available. And we are continuing to work very closely with the Welsh Government and with the profession in order to seek a provision which is consistent across the whole of Wales. And I would urge and aim that that will be with us perhaps sometime during the coming year, but I'm not able to make any promises or give any firm timetables because it depends on several different factors. And the close relationship of cooperation and collaboration is really very important to us as an organisation, and indeed to the NHS in its entirety. So that is why we are operating in the way we are.
Diolch, Ifan. I'm in the same situation as the questioner in that I can order a prescription and that's all I can do. And I think it is worth emphasising, and you did there, Ifan, that it's not ourselves who can't set a date or won't set a date. It's very much in the gift of others to for some things to happen to enable us to move forward at the pace that everyone hopes we'll be able to move forward at. What I do know is that as we get beyond the full functionality that's already available, the opportunities the app offers for people accessing information about their own personal healthcare or managing their own health and well-being is, I would hesitate to say limitless, but it is certainly huge. And I very much hope as we move forward that the resources will be there for us to really get the app supporting people's citizens of Wales' health and well-being and managing their own healthcare and healthcare pathways. Let me just check. I don't think there have been any further questions asked, which there haven't. Helen, I don't know if you want to say anything before I wrap up the AGM, but by all means do.
I just want to pass on my thanks again, really, to the organisation and all of the hard work that's gone on this year, and to thank my team and the board for all of the support that we've had. Hopefully, that's been a good kind of overview of the annual report and accounts for this year. Thank you.
Thank you, Helen, and I'd echo that sentiment to thank, repeat again, thank the board for your diligence and work throughout the year, to thank all the staff of DHCW, those who were with us before the start of the year and those who've joined us through the year. Without you, of course, we couldn't have achieved all the things we have achieved. And to all those we work with outside the organisation, I very much hope that we continue to do that in a constructive manner and in ever closer ties, because without working in partnership, we, as has been referenced in the previous answer, we won't be able to achieve the significant and the medical director would never forgive me if I didn't say this, the significant digital benefits to patient safety and patient care, which is what digital is all about. So thank you all very much. It was a great year. As they say, onwards and upwards. Thank you.